Good afternoon, everyone. How are you? Thank you once again for tuning in to this COVID-19 update, Thursday, November 19th, 2020. We appreciate you all tuning in with us here, especially because of the increase in positivity cases throughout Arizona, Pima County, and our own community. We'll be updating you every week until we think it's necessary to go every other week again. So my name is Matus, the Tribal Emergency Manager, and today we have Dr. Renteria, our Health Director from the Health Department. Today I'll start off with some statistical numbers again. So from the Tucson area, reporting date of November 17th, 2020, our total is 691 positives. Confirmed deaths is 12. And from the testing time, or the testing dates of March 23rd, 2020 to November 17th, 2020, negative results is 5,909. Positive results is 360. And positive since last reporting date was 17. And recovered cases from all our sources is 572. And all that was for the Tucson area. For the Guadalupe area, reporting date of November 18th, 2020, our positive cases from all sources is 836. Our confirmed deaths is 18. And from the date of May 11th through November 14th, 2020, our positive results are 209. Recovered cases is unknown at this time for that time frame. And again, that was for the town of Guadalupe. Next, I'd like to remind everybody that today we still have testing at the Albert B. Garcia Center until 5 p.m. today. And then we'll be testing again Friday, November 20th from 9 to 5 with a 1-hour break for lunch between 12 and 1. And then Monday, November 23rd, we will test again 9 to 5. And Thursday, November 24th, 9 to 5. And remember, tomorrow on Friday, November 20th, we also will be doing the antibody test. And I'd just like to also remind everybody, we also have a rapid test available now. So if you feel that you haven't been tested, or you need to be tested, or you've had significant exposure, please come in and get tested. We urge everyone to get tested so we can help combat this COVID pandemic. And that's all I have now, and Dr. Renteria will talk to you about a few things. Thank you.
Good afternoon, buenas tardes. Thank you for tuning in. What I'd like to cover first is that we will be distributing on our Facebook, and eventually we're going to be mailing these out, is some flyers with information to remind people what quarantine is and the rules that you have to follow based on what the tribe's executive order. And the other thing I want to cover with you is that, again, like I mentioned last Thursday, is our biggest issue is we're coming up on our Harvest Day celebration and also on Christmas. And traditionally, we gather with family and friends, and that's what's going to be a major problem this time around. So what we're recommending officially from the health department is that, if at all possible, keep your number of people you're going to gather with to about 5. I realize that could be like almost ridiculous for some very large families. So because of that, I think you need to start thinking creatively. Maybe think of the Harvest Day is not just a one-day event. It's on Thursday, and most of us have Friday off. And if you don't, then you also have Saturday, Sunday. Think of maybe having the holiday spread out over that time, so you can have different people coming at different times. Without those 4 days, if you do 5 people per event, that's 20 people that you can accommodate and still keep the numbers low. And also, if any of those, even if it's one of the 5, is someone that is not normally in your home, then you should all be wearing masks, especially that person, okay? So those are just some ideas, and we're going to send out a flyer on that also. The other thing is think of other ways to celebrate, instead of just the dinner, maybe other events in the morning. I know that I have some folks that are already planning on having some virtual get-togethers with people on their laptops, if they have one, through Zoom. Some are going to be more like a brunch thing, and some later on in the afternoon, again, where you can get a hold of folks but not physically be being present. So again, I want to remind people that it's very serious for us. Andre just mentioned how many people have died. I don't know anyone in the health department that did not know those folks, and some of them were my patients that I had taken care of for almost 15 years, and I know their families, so it's very real. And even if you haven't been touched by that, it's not impossible that you won't, even if you don't have anybody that's 65 and over in your family. We have people that have passed away in their late 30s. So there's no guarantees here. So that's really the bottom line. This community is not a huge community compared to the general population. So every person's life is very, very critical to us. So the way we can prevent that is by, again, being real careful, wear your mask, social distancing. And again, if you invite anybody to come to your house as a guest, make them wear a mask, and you should wear a mask too, and have them wash their hands very frequently while they're there. So remind you again what the rules are is wear a mask, social distance of 6 feet at least, and we're talking about even during the Harvest Day celebration, and washing your hands as frequently as possible for at least 20 seconds. Okay, thank you, and I hope that you help us try to keep this community as healthy as possible.
Thank you, Dr. Renteria. And I'd also like to remind everybody to please, keep your eye out for messaging coming from the incident management team, from the health department, from tribal council, through all of our platforms that we're using, whether it be Facebook, Nixel mass messaging system, the radio station, flyers in your mailer, in your mailbox. We're trying to disseminate all the information that Dr. Renteria just talked about in many different platforms, so everybody can share the information and pass it on, especially to those that may not have the ability to receive a text or receive an email or get on Facebook, those type of different things. And if you do have a phone, I'd like to remind you to please text PY Tribe to 888-777. Again, I'll say that. Please text PY Tribe to 888-777 and opt in, and you'll be able to receive mass notifications about all the things that we just talked about related to COVID and other pertinent things that we're concerned about. With the help of many people working on another project, the Pascuyaki tribe is building out another network platform to help distribute information. The tribe has started a project to bring high-speed internet service to all the homes here in our community. It'll be free installation and free service for 1 year. Those residing here on the reservation will begin to receive information about the program and how to sign up very soon. There will be, here's the flyer that's going to be sent out. And as it says, people that live here in our community that are renters, they don't need to respond or contact the number or the website because tribal housing or the network company called Native Network will be contacting you to set up a schedule to provide the installation of the equipment in your home. Homeowners, we ask you to contact 833-364-0593 if you own a home in the community and you would like to have this equipment installed for free in your home. Or you can get on the website www.pytnetworks.com. So please be on the lookout for that. I know the program, the IT director mentioned to me, Mr. Mavis, that they're looking to launch this program on December 3rd. So tribal council, the incident management team, and many department heads in the health department, the IT department, everybody is working diligently to try to provide all the services we can to keep you informed about the COVID pandemic. And as it's changing, we're trying to change it and work with everybody in the community to keep them safe. So again, we thank you once again for tuning in with us. And again, we thank Angel, Mr. Lopez behind the scenes, Mrs. Nunez for putting together all the paperwork and all the behind the scene things in the taping. So thank you once again. We appreciate that. Bye-bye.
Bye-bye.
Thank you.